difficult?
Yes, that's I give that to you on purpose to see how you can deal with it. Okay. Julian McDonald, dear admissions officer, or we can say dear sir or madam, I'm writing to transfer Mr. McDonald, a 68-year-old gentleman who had an elective left total knee joint replacement surgery 5 days ago, and will be discharged today for immediate treatment. Okay. And
I try to put any purpose on it.
Yeah, but basically, the purpose is I'm writing to transfer Mr. McDonald for immediate treatment or for immediate management. Okay. You said that here, Mr. McDonald had non-eventful total knee replacement surgery here. Okay. So we didn't need to say 5 days ago here.
Yes.
So if I say who has had an elective left total knee joint replacement surgery and is being discharged today. Okay. For immediate treatment or for immediate management. Okay. Mr. McDonald had a non-eventful left total knee joint replacement surgery on 20th of July in post-op period, multiple analgesics, and 6 days Caflex, 6 days of Caflex, a 6-day.
It's 5-5.
So yeah, we need to either say 6 days or a 6-day course of Caflex were ordered, or 6 days of Caflex were ordered for pain and infection management. Okay. Respectively. And moreover, he received a nicotine replacement therapy. We don't need air. Mild agitation, insomnia, and sleep apnea, even with a low dose of analgesics, were notable. His mobilization was slow due to pain. Okay. Today he will be discharged with the plan. Yeah, I think it's with. Huh?
Yes. Sorry.
Consistent with physiotherapy. What do you mean by consistent with? Occupational therapy to check his home, sleep studies for possible obstructive sleep apnea, alcohol and cigarette quit programs.
I'm sorry, that was at 12 midnight. I wrote this letter.
And the list of medications that will be attached to the letter.
I don't know. It's okay or not. That's the first time I wrote it. I want to ask you.
You know, it's not okay.
Okay, thank you.
Regarding his medical and social history, he has a history of.
Yes, not had. Yes, because
you can say he has had osteoarthritis, gut hypertension, PTSD. His BMI is 35. He smokes 20 cigarettes per day and drinks alcohols 6 to 10 standard drinks per day. And he lives alone in a caravan. Okay. I appreciate if you could manage Mr. McDonald care and follow his discharge plan. Okay. And should you require more information, please contact me. Yours faithfully. Good. Okay. You mean Mr. McDonald's, probably. Okay. Good. Smoking cessation. Yeah, we don't say alcohol cessation, but cigarettes, smoking cessation programs. Okay.
For
So,
alcohol, it's better to write cut down. Oh, I'm sorry. Yes, cut down alcohol and cigarette cessation.
we say smoking and alcohol management services. Okay.
Okay. Mhm.
Um, we have a smoking cessation,
Mhm.
not quitting. Mm,
Oh,
okay. Right. Okay. Um, so he was given 6 days of Keflex, and what happened to the amitriptyline that he was given, and he had urinary retention, uh,
yes.
and after that he had urine infection, and then we gave him Kefalexin, but actually the bacteria were Staph aureus, so probably contamination. Hmm?
Um, I I actually dismiss it because I just as Keflix is order. It
Uh,
need to write everything.
no, that's what I'm asking. I'm being the
Oh, I guess.
devil's advocate. I'm saying if you write Keflex, why don't you write the name of the other medicines that are attached to this letter? Let's see, where is that?
That
Oh,
was a lot.
I can't see them. Yeah, where are they? Okay. So you lied. So you said that you do something and you didn't. Okay. This is just this is something which is an invention, and a lot of teachers make this up, and they say, well, if the letter is getting too big,
Mhm.
just write that I will attach this.
Yes.
No, no, no. Okay,
Okay.
this is just like speaking to a mannequin. Okay, when
Mhm.
you're having a CS exam or an examination, and you talk to the mannequin, say, "Hello, sir, how are you today?" and they will laugh at you. Okay,
Mhm.
so don't do that. If it's relevant, you need to write it. If
Okay.
it's not relevant, you shouldn't write it.
Okay.
Okay. Okay. Um, we need to know what happens in this in rehabilitation center, and who is this admissions officer we're talking to, and then we can decide how respectful we have to be, and then basically how formal, and if we can actually tell them that please follow Mr. McDonald's care plan and follow
Mhm.
his discharge plan.
Mhm.
Okay. Uh, right. So who is the
It's not
admissions officer?
appropriate.
Well, it is. Yes, that's fine.
Yeah, okay. Okay.
But yes. Uh, but we need to know what
Mhm.
happens in that rehab center, because the rehab center cannot actually um, uh, arrange obstructive sleep apnea sleep studies. Okay,
Oh.
that is not something the rehab center does. Um,
Mhm.
it's usually respiratory medicine, and it usually requires a referral from GP. So basically, yes, if you write a discharge letter to the GP, you mentioned that he has had, he seems to have obstructive sleep apnea, and he needs to be probably investigated if you want to consider it. Okay.
Mhm.
Then what does the occupational therapy do?
Occupational therapy does actually, and occupational therapy does check the occupation,
Okay.
environment, and house environment, and I think like this,
Okay. So it's
and job. Yeah.
Is basically they look at the function of the patient or of the person against their environment, and they make a decision whether it is matching. Now, this could be, I mean, the abilities and the disabilities. They consider these, and they match it with the environment. It could be
Mhm,
workplace, home, or any other place.
mhm,
So basically, we're asking. Um occupational therapy to make a home visit to
mhm,
look at the home environment. Okay.
mhm,
And so, because we want to say this, we have to say why. Okay.
mhm.
Therefore, we have to say that he lives in a caravan before this. Okay.
Oh, mhm.
Does that make sense?
Yes.
So basically, before we say he needs to have uh, uh, this one, where was it? Occupational therapy to check his home.
Mhm,
So, okay. So before the plan, we need to talk about this is the discharge plan you're giving. Okay.
mhm.
Before the discharge plan, we are actually giving the risk factors that he has. Okay. We explain why we're saying this. Okay. So basically, the discharge plan usually comes near the end of the letter.
Okay.
So we say how he came in, he had this operation. These are some risk factors he has had, and this is our plan today, and this is the future. Okay.
Okay.
And what happened to his sutures?
I don't know.
He has sutures, doesn't he? He had an operation 4 days ago, was it?
Yes, 4 days ago.
Okay.
Yes.
So what
I
happens to the sutures then?
I don't know.
We
Uh,
had
uh,
it. Yes, we had it in
yes.
the plan.
Oh,
It was
it
uh,
wasn't. It wasn't the letter.
it was
I didn't see. Maybe
our,
it's my mistake, but I didn't see anything about the suture.
well,
That was.
because yeah, a lot of people write a review of systems, but it actually ROS in 10 days. It means removal of sutures in 10 days, and
Oh,
that is part of the plan. Okay.
yes. I think it's a review of system.
Okay. Okay. Removal of sutures in 10 days, and he has an appointment in 2 weeks' time. Yeah, with
Yes.
Mr. Mosley.
Yes. Oh, there was a
Uh,
lot of things I missed.
okay. So
Oh,
the most important part of a transfer letter or a discharge letter
mm,
is, in fact, the plan or the future plans or something that comes next. What
oh,
has been done before is not that important.
yes.
Um, what difference does it make that he had Keflex and he had a UTI or he had anything like that? So, what is the significance of that for a rehab officer?
Nothing. Because that completely remove and
Mhm.
I get I think, but I'm not sure.
Yeah, I mean, basically, what I'm saying is, if I show you, I've prepared something. It's not the best of the photos, but anyway, that's the best I could do. Um, so, if you look at this,
Mhm.
now, suppose you have somebody and you require a diagnosis. Okay.
Yes.
What you do, you start talking, you say, well, this is the presentation of the patient,
Mm.
history, physical examination, findings in paraclinic, and the treatments that were given and the response. And now I wanted the diagnosis. Okay.
Yes.
So uh, basically, if I say, uh, can I come down here? Uh, duh, 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 duh. Okay, so if we want a diagnosis, we start from presentation and we go on up till the tests and findings and medications. Now, if you have the diagnosis, if you want management, for example, you have a patient with MI and you want help with management, and we have basically we have two types. One is urgent, one is non-urgent. So if it's urgent, we just need to say very quickly what the diagnosis is and what the patient is, how the patient is now, and what has been done to stabilize the patient. Okay. So if it's an urgent case, basically what we do is just say the diagnosis very quickly and what has been done and how the patient is. Okay, and that is what basically we don't go too far from presentation, detailed history, detailed physical examination. No, very quickly we say what is the diagnosis and why, and what has been done. Okay, because that is important. Um, but if it's non-urgent, you want someone, for example, you're asking for non-urgent, you're asking for somebody, a specialist to help you with management of, for example, inflammatory bowel disease. Somebody has Crohn's disease and you're not sure. You say, okay, this is the diagnosis, and then what you say is what you have done and what the result is and what you require. Okay, so basically you say, well, this is what I have done, this is the result, and it's not better, so I require help. Okay, so if we go down to discharge, when we have discharge, in discharge, we know the diagnosis, okay? Therefore, we just need to say, well, the patient came in with this diagnosis. Okay. Excuse me. And so what is important is whatever happens from now on. Now, let's see how this background is important, okay? If we have an elective surgery, who has sent us the patient? The GP. Yes?
Yes.
The GP knows the presentation, the GP knows the history and physical examination, the GP knows all of these. The GP has come up to here to the diagnosis, okay? So we don't need to say this again. And GP knows the past medical history, so we don't need to say that, okay? So what is important when we have an elective surgery, we say what happened after admission when the doctor, the GP doesn't know. And actually, what is significant? So if something is not significant, why should we write it? If somebody goes to hospital, has an operation, and we say, yes, we gave him painkillers. Okay? Yeah. Okay. Yes, we gave him oxygen after operation. Okay? Oh. Okay, and he was MPO before the operation, and he was given liquids or fluids after the operation. So what? What does that mean? It's meaningless. So what is significant is the patient had 2 units of blood transfused. Okay, so that transfusion needs to go into the notes, and that is something significant. Okay.
Yes.
He had severe withdrawal symptoms. Well, that is important. He had, I don't know, malignant hyperthermia. Okay, so
Yeah.
these are the things that are worth mentioning. But the fact that he had a UTI, and rightly you actually deleted the amitriptyline, uh, but you should have deleted the Keflex as well because that's not relevant. Okay,
Hmm.
it's not significant. But in
Okay.
fact, what was significant was that he did not respond to morphine. Okay, and he was put on ketamine infusion. Okay, does that happen to a lot of people?
No.
To what sort of people?
Uh, Maybe the people that they are addicted before
Okay,
to
good.
morphine.
Okay, so is that a significant point?
Yes.
Yes. Okay. Right. So if it's elective, then we only say what happened after admission, whatever is significant, or whatever is we want to base our plan on something. Okay, if we want to base our plan, for example, we say, um, yeah, part of our plan is to is smoking cessation. And that's why it is significant or relevant, and we have to say he was started on nicotine replacement therapy. Okay, and that's why it is significant because this comes with a consequence. Or we
Okay.
say he lives in a caravan, and why do we say that? Because we are going to say that he needs to be checked. His home needs to be checked by occupational therapy.
Hmm.
And then we say he needs to be referred to the social services. Why? Because it's not usual for someone to live in a caravan.
Hmm.
Okay. So, but if it's
Uh,
non-elective, yes,
may I ask a question? I'm sorry to
yes,
interrupt you.
yes.
Always we refer after surgery or any procedure to a GP that he or she knows the patient. It's always
Yes, indeed, and I will tell you in a minute. Okay,
okay.
that's one of the reasons why I give this case to you.
Mhm,
Okay, so non-elective surgery,
mhm,
non-elective admissions.
mhm,
Suppose an elderly woman who has a fall and he's brought to the hospital by ambulance. Okay,
mhm,
the neighbors called in. They said this has fallen. Ambulance comes, takes her to the hospital. They give her some liquids and fluids,
mhm,
and after IV infusion, she's better. All the blood tests, everything is normal, and she was just dehydrated.
mhm.
Okay, now we are sending her back home. Now, here we have to explain to the GP. We have to say, well, the details of admission, uh, because the GP doesn't know. It's not.
Okay.
It's not
Yes.
elective.
Yes.
And what was found and what was done, uh, and how is she
Mhm.
now, and recommendations like if we have any. Okay. So the nurses use a tool here, which is just recently is being used by the medics as well, and they call it SBAR. Okay, and SBAR means situation. Okay, what is the situation, background, assessment, and recommendation. Okay. So that is, it works in urgent cases. So
Mhm.
basically, in urgent handovers, that is something that the paramedics use and the nurses use a lot. Very quickly, they say what the situation is. The situation is a lady who's had a fall, has been admitted, brought in via ambulance, and that is just our first. second paragraph. And then the background is that she has these comorbidities. She lives alone, blah, blah, blah. Our assessment is that she has been dehydrated and that's why she had a fall. And then recommendation, we write to the GP, say that, well, we think that you need to look at her, make an assessment to prevent falls by occupational
Mhm.
therapy or maybe a care, social services, anybody to prevent further falls. Okay, so that is basically a non-elective because the GP doesn't know. But still here, we shouldn't write anything about the past medical history because the doctor already knows the GP.
Mm.
So it's not relevant. Unless you want to emphasize and unless we want to base our recommendation on something and say that, okay, because of this problem, which is worsening, for example, because of worsening memory, we think that it is appropriate to request a further memory assessment for this patient, okay? Uh, or because of loss of function, we think she needs to be referred to the social services. Or this is just a recommendation. It's not, you can think about it, you can say yes or no. So basically in transfer and in discharge, what we have here, we have the diagnosis and we have managed the patient, and now we are sending the patient out. Now, it could be sending home or sending to another facility. In any case, what is important is the future plan, okay? Whatever
Okay.
has happened before now is either not relevant, or if it is significant enough, we can write it. And if we have some plans based on a finding, we can say it, and we can say that is why, that is the reason we are
Mhm.
making this recommendation. Okay. So, uh, right.